patient plan-centered care came up through a competition actually. We had an old motto and we felt it was kind of dated, and we also really wanted to see what the staff at UHN thought about our environmental program. We put out a call, we said we're going to have a contest, tell us what the environmental programs at UHN mean to you. We got a lot of good responses, but the one that really stood out was the one that said committed to patient and planet-centered care. There are several environmental programs that the Energy and Environment Department oversees. We can provide healthcare, which is really resource intensive, in a way that's mitigating the negative impacts which may cause health effects outside of healthcare.
TLC is our energy management framework. It stands for Turn Off Lights and Computers. It's a program that encompasses process behavior and technical changes that help our whole organization to become more energy efficient. The Green Team started at UHN about 15 years ago when our department was first founded. The idea was that we wanted to have eyes and ears on the ground to look for areas that we could improve.
Well, I joined the Green Team because as a manager on the unit and very conscious of the budget, even though supplies appear to us to be not expensive, they add up. So I created the wall of waste as a visual thing for staff to be more conscious of what we're wasting. If you should go on 9A, you will see a large board that has different supplies with the cost attached to them, just to make people aware of how much wastage that is happening on the unit. The visual is certainly better for people to understand that versus telling them all the time.
So the Golden Light Switch Award is an award that's given to either a group, a team, a department that is instrumental in initiating some TLC strategies, and we were granted this award this past year because we have been very instrumental in trying to make sure lights are turned off, putting up the signs, getting staff involved.
Something that I really like about the Green Team and TLC is that I like how it provides variety to my day. I think it's good to incorporate those things into our clinical care. Because we're in a patient environment, we as our staff and also our patients are washing our hands constantly. So we produce, I'm sure, a ton of paper towels. So one of the initiatives that I'm looking to take on in the future is to instigate having either recycling or composting for our paper towels so that it would divert quite a bit of our garbage into those streams rather than into landfill.
The recycling initiatives at UHN are pretty fantastic, actually. We have a lot of elements that go into them, so it's not just a matter of making sure that we have recycling, it's making sure that we have recycling work the best for its next stage. Recycling at UHN is a very important program and something that we're really proud of in the Energy and Environment Department. We really try and make sure that it's something that all staff and visitors and patients even can participate in. But we don't just focus on recycling, we also focus on things like composting, e-waste, and also reuse. That's one of the things that we're even getting forward to, because as important as recycling is, it's even better to reduce and reuse.
The savings year to year are growing. We're looking at about $1 million in savings in utilities this year with a goal of about $2.5 million.